Cannabis. Another name for marijuana is a tall herb that has a tough fiber and is often separated into a tall, loosely branched species and a low-growing, dense branched species, used specifically for cultivating varieties of having high levels of THC. So what is cannabis oil? Cannabis oil is a thick substance made of cannabinoids removed from the cannabis plant. You might have heard cannabis oil called different names such as marijuana oil, THC oil, CBD oil, hemp oil, and hash oil. As you can tell, the different names can be confusing. It is hard to understand these terms in relation to each other because they don't necessarily fall into the same category. THC oil and CBD oil are cannabis oils, but a particular cannabis oil may or may not be considered either. In other words, cannabis oil is an umbrella term for different specific oils. This has implications on what the oil is used for. As you can probably guess, THC oil isn't as applicable as CBD oil. People who take cannabis oil feel the effects of cannabis, recreational and medical usage, more intensely. Its power from the cannabinoids, which are from the plant, that help produce the production of seizures, anxiety, in those who suffer from cancer. I will begin to talk about the 3 medical conditions that help reduce numerous effects of the condition due to the impact of cannabis oil. Anxiety. Anxiety is a well-known stressor among common individuals. The common issues include clinical anxiety like social anxiety, PTSD, OCD, and additionally common types of anxiety such as sleepless nights, tight due dates, and fear of heights. In addition, many people are prescribed anti-anxiety medication that have numerous symptoms. In contrast to that, CBD has little to no reaction to aid patients with all the typical side effects of anxiety such as dismissive thoughts, sleepless nights, and trouble being around individuals. CBD interferes with the body's own. The ECS is available in about each cell in the body and manages many of our body's capacities, including appetite, memory, sleep, food, and perception of pain. So how do we use CBD for anxiety? A CBD vape pen is likewise a choice, and there are a couple of them mainly intended for anxiety. Edibles are rich in cannabis. Cannabis are another essential decision for those wanting to utilize CBD for anxiety, such as not pot. Cancer. The usage of cannabis oil for cancer has been gaining popularity on a worldwide scale, but studies have also demonstrated the positive effects it has on other diseases, such as epilepsy. Cannabis oil contains chemical ingredients produced by the plant called cannabinoids. If you are in the exploration phase of the value of cannabis oil, it is important to know the difference between the cannabinoids and the cannabis oil. So how can cannabis oil help you? Cannabis oil can help you if you are a cancer patient who does not take "we have done all we can do" to heart, but instead look for an alternative method. Maybe you are convinced that the Western medicine practices are right for you. With safe, high-quality cannabis oil, you are providing yourself with improvement in your well-being and your standard of life in regards to managing your pain. Seizures. Epidiolex was tested in 3 randomized, double-blind, controlled trials, which revealed that the drug was taken in contrast to the other medication. In effect, it reduced the frequency of seizures in patients, which then gave potential side effects and risks that can also rise from taking Epidiolex, which includes fatigue, decreased appetite, diarrhea, rashes, weakness, insomnia, poor sleep, and infection. The Food Administration, FDA, Food and Drug Administration, approved the medication called Epidiolex to treat 2 forms of epilepsy that begin in childhood. However, it is not quite medical marijuana. The strawberry flavored syrup is a purified form of chemical ingredients found in the cannabis plant. However, it is not one that gets the users high. The CBD oils have altered top ingredients to help various medical conditions, but the most important form was altering seizures. This oil has helped not only adults but children in bettering their seizures and symptoms. This oil is helpful to those who wish to experience and want to try alternative ways in helping themselves. In conclusion, unfortunately, cannabis oils research is still examining the lasting effects of cannabis usage on these 3 areas. And the verdict is that short-term benefits are still existing, but the long-term effects are still undergoing to keep symptoms and reduction of individuals suffering from cancer, seizures, anxiety, giving them the beneficial needs they are looking for. It's clear cannabis oil is not a curing mechanism. It, however, has many benefits, as previously listed for those suffering from the leading conditions of cancer, seizures, and anxiety, and much more.